Dear friends, you are welcome back. Asem Kesiye so Anna Yedui. This morning we have a rather very interesting topic for a discussion. Now remember, beyond the mastery of our discussants, we are also going to pick your views. And so don't hesitate to pick your phones and get ready to wade into our conversation. This morning, remember, we have been asking a question, and the question has been the fact that, do you have a national health insurance card? And if you have one, how have you used it? Do you pay when you present your card, or you're able to go through the system for free? Have you even renewed your insurance card? These are the questions Ms. Na has been asking. But more in perspective, we are looking at access to health service in Ghana, the NHIS in perspective. Na meka say anope ye bisa question say Ghana National Health Insurance card ya wo ko akohwe wapomudin a utimi de ko na yahwe na yehwe na wo bia ne aka say ye besa oyare free no wo bia da ben na wo yusu ye so wo yusu a wo yusu ye sanje wo sika bi eka ho ana enne yehwe eye apomudin e wo Ghana na emum ni mpompon so ne say yehwe National Health Insurance eye scheme a ye nyina Ghana da ye so a e wo amamramu say ye yusu. To do this discussion with me, it's a friend, a senior brother, and a colleague, Dr. Isaac Charles Noble Morrison. He is a private medical practitioner and a member of the NHIA board. Doc, you are welcome. Good to have you here.
It's a pleasure having you. See that, yeah.
That's right. The biana phones so now your phones and then out of all your busy schedules. Yes. Usually when we welcome our guests, we want them to greet. Inti when I'll bet you no
pay. I don't pay for me mamunina ajo. Good morning to our cherished listeners.
Okay.
It's a pleasure to be with you this morning, and we hope that we shall all learn something new from the discussions that are going to take place.
Yeah. All right. Doc, in just about 2 minutes, give me how your journey in medicine has been like. When you completed school, what your specialization is, and why private practice?
Okay. I started medical school in '74.
Okay.
Then, for one reason or the other, I had to leave and travel to the USSR then.
Okay.
To continue over there. Then graduating quite well. Came back home. That was in '83. I was posted as a medical officer to medical 4th floor of 𝗏𝗏 Teaching Hospital. Yes. And there...
The medical ward?
The medical ward, yes. So over there, I started my journey. It was quite... Those were the days, '83, if you remember. We all queued for so many items, and people would come into emergency room, virtually not having eaten. So many cases of hypoglycemia, etc. It was quite challenging. We had to, I remember we were then chasing our vehicles at that time, and we had to walk from 𝗏𝗏 all the way to the Castle seat of government to go and see how far they have gone with our vehicles. But those were the days.
Yes.
Those were the days. But somehow, I started doing a little bit of locum service. We call it locum,
Yes.
At CMB, then it was CMB Hospital. And then later on at myself and senior Dr. 𝗦𝗢𝗿𝗏, rest in peace, at Port Clinic.
Okay.
And there on the love for private sector practice, that's right, got developed.
All right, interesting.
Yes, but apart from that, I worked all across the country, Tema, Takwa, Bogoso, etc., before finally settling in the private space.
Interesting. Dr. Morrison for short, sana ye tough friend. Say doctor ni kan locum na nurse ni and obi oye juma hospital bi kan locum na che say baby oye juma wo no enye ho na oye adwuma na emu boko ba bi foforo de nka teacher for so friend galamsey
yes sir
and na just waje part time no oye wo baby no na ye be friend look. I know many people have asked what's lokum then na nema churchum. Doc, we also know say you're a member of the National Health Insurance Board. What exactly do you do there before we come into our discussion?
Right. I was attached to your friends at National Health Insurance Authority as far back as 2009. When we started, organizing what we call the Quality Assurance Department. I finally became the directorate. More or less, now we're doing how to credential, how to assess facilities to enroll them onto the scheme. So what yardstick do we have to? So we designed all the, of course, we were sent out for training. We went to Thailand, we went to a few other places for training. So we came back enriched to also develop the clinical audit and the assessment tools, etc., etc. From that time on, then in 2016, precisely 2017 actually, framed to the board to represent the Ghana Medical Association. So I'm a representative of the Ghana Medical Association on the board of NHIA. And I've been on the board since 2017.
That's quite a long one.
That's quite
right.
A long
What a journey. And docs say Yemra health insurance. I want you to try and define health insurance. No, I so with me Eden Krana one ejake mbanwako wiogawa. Ewo mene ke ga ke tuefen afufu. Because say health insurance. E dey na health insurance.
Ni tietie mo an say sebe ebia de wetu esike bi anaso condition e kire say or say aban no ehwe ana wodwuma we employer ohwe na ukọ hospital ana ukọ ayasabia won say esike bia on your own. So in essence, you have either purchased an insurance. The insurance company is pooling risk, pooling resources. Na ya di ahwe bebre. Ya ka say pooling risk meme ebi asab me ne we yati mpomo ya wa hoden yare bi ani ye ho but ebi ama ana akosua ono yare ye de yen na abebom ama even though yen ya wa hoden yen yusu but ama be yusu. That is the beauty of it.
Yen nyina ye de sika I just say enoboa
sa na sika no it has your graduate ebi wo hodnom a sebe ye hwe na nimpako no onisika or you're poor because it must be Ghana a social intervention. Into the is pro poor. And now the vulnerable. Into Usha there no or everybody up to the age of 18 or Sebe Ghana or Yakolad untia. Or painful so preocupa unyama untia. Free.
Into a card,
or say in fact unya you say ukwa so your card no waiting period near the help and now would be above 70 so and so help free and so now but the akano obia contribute either through the formal sector say or slate contribution futuro no and ebia your friend saying your tax and say how yes, tax revenue. So see, bibia obetobia. There's a percentage of omote free so. Into all those monies, you're getting in an eco for tobacco. No, by finance minister and the finance outfit, it release gradually, systematically. Edama NHI, yeah, they are share or mining in so can kabagami or health insurance a be chagashi taflache either budenche ubanyo pay agashi okay ya premium yeah NHI premium in fact fair they are nothing to write home about. Very minimal 30-40 cedis for the whole year. It's also possible like you are a poor person or you are vulnerable. 18 years and below, or pay no. Abahabo card there. There's a processing fee and I pay. Call it actually 70 years or pay no. Abahabo in the card there. So these are the apart from that no fear no by here man here. Achio no 2.5% ko e buyer for trouble. Na ba jefe ni ke abua fair na ni Minister of Finance every month be release shika national health insurance.
Donc na say makotu ya premium e be 40 Ghana na 50 Ghana na ye one time premium. Say ne me so me koto ade ni atete ana say wo me senate so no osisi mi because me ye tete sa.
Okay, that is the nature of insurance because also you pull resources near there.
Okay.
It must always be equitable and sustainable. Inti you hear say wo sika no bi niska. They be enyan sa. Aha. Inti once a wo beto ade ne there or say yete. Wo mu say sebe also betumi contribute to say what to premium to say they are okay. But what is 40 cedis for the whole year? And one time, we use to phrase one time, and one time. It's renewed annually.
Okay.
Into Afibia or so sign call. Won't try my feelings so. Maybe I can boss me back one and me no I could renew.
You better that back card no so na ya card ne far by. Tinanka me baby because as a card no crown no they call SPT how many times but they be back. Okay. Minimum say a Ghana mamra and ye jinaso.
Yes.
And so our viewers another secret about this honorable man who is a true Methodist. Also a lawyer. He's not only a doctor, but he's also a legal practitioner. Ebi a baby we are maybe son the intia or dokutani penny papa penny wa won ma kuko suku akọ university or also okoye law and why we are all practicing. But amamra na yegina so it's a constitutional demand. Me pacho efihi ene besi hi ana amamra be na yegina so health insurance.
And my man started a health financing journey. No?
Okay, sure.
Before independence, no, Oko hospital free.
Okay.
That
is before 57.
Before 57.
Okay.
After that, no, I buy it to us. Or continue with the free medical care, no. Until maybe I'll be kubia. But after a time, no, if who say and you're sustainable. Oko we ni ho we asa nya bibi nti e ba ne say you be cash and carry ukwa na okutua na dia ope bia do na ya ama ya yusu gosa ya tusika ya yusu we ya tusika nti after that no na aban foforo e ba so no ehwe no so no we nya de a ye betumi edebu o man maye na ye to ya adwen ko echire a from Alma Ata Declaration 1976 health for all by 2000. Yeah. That was the phrase at that time. So the whole world was thinking about say yebe bob modern near share young population baby awubiano at least near exposed to the hardships. Say we are now we drink Maiden and Marco Hospital, Maiden and Mitia and Hong into all those things in the community. Let's think about how I be to me, IABB. And then no 2003. Almost passed the Act 650.
Okay.
That was a national health insurance scheme at that time.
Okay.
Now going forward, then 2012. You be set up the authority for which now I'm a member of the board, and that act by Act 852. Okay. It sets up the authority, but the scheme also is being operationalized. Okay. First, 2003, there no, me fancy one kranza, and kranza was one scheme. Yeah. District be our ne the board or ne BBR into. There wasn't uniformity. Ebi awokwa nkransa yebema we ebi awoko ebi amami krom ebi enyande nchira different thing yebema. So there wasn't that uniformity. Okay. So this new act by 852 no operationalized it said there should be one central board, one central command center yemfadisa. Okay. No nhwe omine so nyinara. Na resources no yempulu no baako. Na nkogu futuro baako. Na yin creative fund na fund no and share obia or Ghana so that Mbrano Ayeshe Act 852 no say every person living resident in Ghana.
Okay.
And yes, Ghana.
So it's not even for Ghanaians.
As long as uti or man or say uji card.
Okay.
That is the beauty.
Okay.
Then apart from that, you know, NHI card in the compulsory. We Juma was here. We are Sabi. We are Methodist. We are Juma or Methodist society, whatever. Also, employer no, we make sure say what NHI card. No? Okay. Apart from that, no UNS officer open say oje private insurance so can one.
Okay.
But the compulsory aspect, they say, as long as you are resident in Ghana, you must be a card bearer.
Wow, I am hearing this for the first time. Remember, Dr. Morrison ahome na mama ahwefo ehunu say ye papa ye nua ye bra pani Dr. Morrison Methodist name ma papa oka National Health Insurance Authority Board no ho ono na ne oboa ya me ate National Health Insurance ne ho asem na asem ba ko a waka kire yesisi a ne say it is compulsory for any human who lives on this country called Ghana. What Ghana munkria there a compulsory by law say ubenya a National Health Insurance card ni bi nya card ni bro na emum say we renew bibi aye krojen amount. Did you know that? Yo, all right. No, now let's come to the card, which by extension a identity keke. Name to me bang and a work card name. What is the power of the card? Okay, sir, act na establish NHI no actually their card no to me what's our card. Okay, as long as the card no active. Make an activate means expire in year. Oko hospital I asabi bia obekono or say your package. Na mamenka ebia before I come to this. Normal insurance company there are 5 components also now here. Okay. Coverage. Population I will cover supposed to cover everybody. The second thing, also when your benefit package. There's no health insurance policy behind any benefit package. You must define both the depth and breadth of that policy, package. Make a package. I say, me cardi me demo be and I will enroll with this insurance company. Na Ghana there. Ebe cover A, B, C, D, E, F, G. And cover QRZ. Okay. And then no benefit package. Now, the beauty of it is it covers almost 95% of our disease burden in the country. Okay. It is quite broad and quite deep. Okay. That is normal. Number 3, also we design what we call provider payment. They are ube fair as they are sub be because enye na ukuta hospitals and our clinics na nafa ube enroll omo and na make say ya ye nhihye a ye de hu say sebe we hospital or say wo we enyoma bi poten wo ho a ye betumi hu say oh say ye soma ana ye ka say ye card bearer no ombra ho no omje ayarsa obenya ba better you get quality. Okay. Until we have what we call indicators and yardstick measure up. Health center, CHIPS compound, primary hospital, secondary hospital, tertiary hospital. Okay. No, we are now actually how you are going to pay for that service. Okay. And then a provider payment mechanism. And running she said, you start a fee for service. I just said you can't say your lab, we lab now the price now by nature. We surgery now the price now by nature. Now yes, a sign you free ho. Ever try be capitation. Okay. And we global budget here the amount. Maybe you enroll be nipa 1 million. I share who say or say 1 million no or say the 10 cedis and $10 and I share you this kind of up front. Into ube bomb modern say ebe so
obia so ye free ho ya Ghana diagnostic related groupings and no me fan say o hwe say the last make out e bia respiratory tract infection na ye group no
okay
disease if you say related no na ye group na ya ma one ABS, there's a payment mechanism for it. Okay. There are several
on the payment mechanism after renewal. Do you have to pay anything at all?
Yes, each time you renew, if you paid a premium, so why would you have premium? And the time you be renew, you be to premium, no.
Okay.
Now, by way of SNIT contributor, you don't pay.
Okay. Okay. For this also another very important clarification. Maybe because Ghana can make commerce and Jimmy Sikebi metia so much Jimmy Sikebi. Doc say. So we will be a brand tia, afibia utia, the afibia uko renew abetia into ukwa se 14-year G se says he can have a sent to you. Nemum say, oh yes, what does it so the any would you wuntia, would you renew an sika and ubitia, renew an so the any born
processing fees just about 4 or 5 cities.
Okay, no born dog
that is the third one. The fourth one, your friend contracting. Okay. Just said, Abia Bepese, Rafa Medical Center, Osha Mayari for a Watema. Until Minombe enter into contract. Bepese be a port clinic. Minombe enter into contract. Bepese be a Nyaho, Bepese be a Ames Hospital. Any hospital. Ames. Yes. Yeah. No. Then NHI will enter into a contractual obligation with them. Okay. Okay. Now I'm stressing on this because say the contract no baby any who I catch us say mintua uka but modern na kwa jisika free minim say baby sa intina me stress say contract so and then the final thing, the fifth pillar is about quality of care. Okay. Once I sign on, we expect you to give quality care to everybody equitably, efficiently, and without any discrimination.
Doc, me card no say me kra no marino. Me timi dia hospital biara.
Yes, but your gatekeeper system. And then unfortunately, you to me and for you. Okay. You can't gatekeeper system. Sebi. Me fan say me am fi say me nya malaria. Nanka ma sorry, I say ukuta card no. Na unim say kolebu si ho, ana out kolego no. Kolebu ben ho. Inti sorry I ko jira kolebu. Say maba, me kuta card. They be okay. You must go through the first layer, which is the primary care or primary hospitals or health polyclinic. Chip compound. Then you go there. Then they would see woman say bro swa no make us say you do the next level. Okay. That is how gatekeeper system is. And Mia baby outside Ghana, no, if you want to defy that system, you pay heavily. Okay. Nothing stops you. Me fan say I walk Krobi. I don't want to mention it in there, but outside where we went. Now me fan say, oh no, I think me person me call half to get my malaria treated. You are going to pay me $70. So pay and go. Nobody has a problem. But the house can you need that. I know what sounds like wasting time. Into the effectiveness of the gatekeeper system and say you
it is a micro card and not say metetema. Minti min ko Tema General Hospital straight away.
Yes, say Tema General Hospital. Say one more. The best thing would be to go to polyclinic. Okay. The best would have been ideally to go first to the polyclinic. Now, no other regional hospital, more or less. Tema General Hospital is now considered a regional hospital. In that sense, it should be a referral point. Okay. Nanka, ufri polyclinic, they are referral. And now if you private hospital be a clinic be a referral.
I think this answers it because if you could do a young shame, Muntia never know because said they would church you can make up Tema Polyclinic and now Kolebu Polyclinic and now any other place chip compound. Now me cock CMU street. Who do also be a nurse if we and as a records for no Omontom was in Chirim. Oh, yeah, so I'm sure someone take my say said there has been some of these complaints or they do honey as a high and then the first person will be forced to pay.
In an emergency situation, the nearest, because it's life and death.
Yes.
Into the nearest.
Who determines an emergency case? Is it the patient or the caregiver?
That is the point.
Yes.
Vincent says, Sebi, but we can easily hazard a guess.
Okay.
Yes. Sebi, Obia all. Na Sebi onyem na prekupe. Awaka no ana moje tun. Yemfa ne sa onyem. Eso moje tun.
Yeah.
You can't toy with that because it's life and death for ono any obano.
Okay. So let me tell you a case I had over Friday. And I had a case on Friday. Na onipano kase o any baby din. And I got to so on to the boss kwesi da ne amano premium service na waye. Otumi twen ya ma kwesi da ne ba. But sa da no gina so se owu eni. O de yemfa ne se kaka. Nesen. Now, is it me patient in me determine say me sending into emergency and as I said ye die mu asebi obi adwene mu kan kakra wo toto ne omatwene chese wa twesekan o de wo feel say enya emergency fiefo so emergency ye dwane akwa kodu kasie mu ye nye case no.
Yes, a bad sa one be sure.
Okay.
Nobody will tell you. Obi eni ho obe which is.
But there have been cases of people
we know. Unfortunately, the eba me comes to mind. The late Mr. Champo, may he rest in peace.
Okay.
70-year-old, or starting the journey, or Tiawoshi.
Okay.
Obaya ba first private facility, or free or call Kolebu General post to call police hospital, police, or several places. Eventually, I ended up with Lekma and Odiwuya, and the Parliament had to set up a committee, say investigating. I remember that. Until, yes, it's possible. So we can just say kwaha. The first time because you nimpa, if you cry no one, but see you nimpa anyway, and that is a little bit of a problem.
Name mutie for ni ahwefo fan show mutrim say Sekobana sa o first reporting base e yenketo mu.
Yes.
Sana dog e ka che wo health insurance card na die so oti Kolebu en so renko Kolebu start fin keto enimu na wanya asem bia o de Kolebu street ana akese mu straight e bia na yankwa nkwohwo ne akase koha na akwakofa oyunum. Now let's come to the power the card holds in terms of the number of conditions or the extent of the condition.
Okay. To say the American your card, your benefit package, they are okay affects the benefit package. Your benefit packaging is quite deep and extensive.
Okay.
And American 95% of your Ghana, it covers it.
They told record said Dr. Morrison, our board member, Emma National Health Insurance Authority, said 95, almost approximately, almost 95% of Ghana, National Health Insurance card, and I want social media to carry this out because this is very important for news. Say on Sorina Shrine, if you did so, you say almost 95% of Ghanaian medical conditions. Yes. National Health Insurance so you betimi agile card na yamo ayarehwe pepe. All right. But
yes. However,
there is a caveat.
The exclusion. Okay. Me start and me can say benefit package no.
Okay.
What they cover.
Okay.
And they cover.
All right.
Yes. Men can say o pese sebi u shape u nufu. And now shape u baby.
Send the enya yare.
So no so fi say
okay.
Fi say na down for nufu no so.
Okay.
Say
okay shape no. Okay.
Okay shape no. Obi sebi wa bet me about ho ka na why. It's not part of it. And your friend there are other cases to say your program diseases. Me fan say a bit is tuberculosis. A bit is HIV. And other cases.
Okay. So what can program diseases
there was special fund allocated for them.
All right. Okay.
Until yare TBA, you go through a particular shall I say facility or outfit
and a particular program.
You almost didn't be for free.
Yeah.
Into no and can't yeah basket
no wabo tuberculosis
and
wabo HIV
vaccinations preventive vaccinations
all right
nti nkwala ye wo ma sa childhood immunization programs ni nyina and ni basket because I don't on one line of activity line of funding then funds and so these are the other ones and cosmetic surgery and and quite a number of other things.
But doc, not all surgeries, but cosmetic surgery. Cosmetic surgery, chichiri mukakra.
Okay, ebia office nehwene achia. Inti odebeko ameya yi straighten na ama no. Obi o office o wrinkles ewo nenim obeko ni aye ama no. Obi o ha because
but say huni tukra dia and is a corrective surgery
and no corrective surgery yes and no say when you accident na ebu anapai that is an emergency that is enu nya say ukona o say yen shape homa debi catastrophe na ato into abana sa na o say you to me
very well
but me fan says to say bia me so me phone so into me come yakoyi fat ni bia ma those ones obi emfi wa wo sika obetimi
aye enti afa yemra conditions enu so kra me pese ye be fa no efi mema ema ni akonkwala nti yenhwe eye mema there are some general conditions those ones you can mention them in passing ti yensha say in general conditions
to say sebe so I put the malaria ya branas into but let me start with malaria. Nobody should charge you for anything the commonest. When you're upper respiratory tract infection, nobody should really charge you. Lower respiratory tract infections, nobody should really charge you anything.
Who used to wear really?
Oh,
nobody should charge.
Nobody should charge.
You don't need to.
You don't need.
Once you have a legitimate
yes. In this area, Adzika. In this area, Adzika. When you have problems with ABR, you are having maybe acid problems, gastritis, gastroenteritis, the digestive tract, most of them. Cancers, some cancers. Some cancers.
What are the cancers?
Yes.
That.
Say am say a man na omulide breast cancer say yetumi e dey share program no mo.
Cervical also.
It's being done now.
It's been done or it's been
yes.
processing and breast cancer it can be taken care of with your card.
Prostrate.
So prostrate.
Afina and so you go
prostrate to nim
prostrate.
Prostrate
is dim. And then childhood cancers for I think about a year or two and the share program into that 4 childhood cancers so the reason why I into me for cancers ni nyina at once or say we hear be a friend actuarial studies or say utumi trans no who say yade we am dey kwahye baskets ni mu no
a chini
percent ye bobo ka ho ka sen na say as we age na say expand ya ka be na de bebrain into o say etumi hwe na who say you ye the shame a ye ho nkokere yen program no will still be sustainable into anya say Sebi, yes, sorry, we would have loved to. Sebi. Me bema. Prostate cancer, no. Bema so yen soon as Sebi, fire. And can be like I say, I then the breast harbor, not with the young yes, but in dry the year breast, no, we were able to negotiate for a heavily reduced cost on the medicines, and no na chere so say once a manufacturer na pini so say obinya breast cancer e draw out say the man no what so pa my ye betumi a contain ya program you say yes ya enya hwe no and na my introduce you the bem into the others the guso aye na omunya botre man obi at say last about a month or two, dialysis once and back.
Dialysis back. Dialysis
and but men fans say when you're acute, you're the acute stage, and they're about on by amount. It's part of it. But when it becomes chronic,
the early onset,
no. But when it becomes chronic, and unfortunately, and also the studies is being done. The outcry that came, they were among 4 years, they didn't yes, and my board, it's not your dream, okay. But actual scientists now more NHI and other groups of people almost study who say, can we? But so far the results doesn't show say be a bit to me. This is be a fund be a but from what we have now, no, it's a bit difficult. But the studies are going on. I'm not mean discourage you be a young bomb says who said in the long term, and when you are doing these studies, you are not looking at 5 years, you are not looking at 10 years, a long term. Otherwise, a crash here. What the IAS and into me, and they see a bayo, so these are some of the things.
Right now, surgery so
okay,
a dear being surgical procedure,
okay,
and a health insurance.
Men for common ones, appendectomy.
Okay.
A cover. When you are hysterectomy, said or back or problems about or say, you know, the cesarean section. A woman, your money in idea, because will be maternal mortality when abrable. It's an auditable. And there be bowel resections near there. Those one mean you can bow is a shabby and not sebi. We could problem be our intestine and Fambia say and also you try near twa. All those ones they are major surgery, but still basket no more basket.
Okay. All right. Yes. Things like hemorrhage,
hernias, yes.
Those are all common ones.
Those are all common ones.
Then now I'm beginning to accept your 95% because looking well, as much as said minimum dear, but we are educating our viewers. Ashrefor say you be in telephone I be say obe kasa witiri. It's an example for na ebu baby at was a one kasa witiri ho aye we bone and the doctor osi ha ono so board is so te ho enti bibia pesa wo ka kire ne bia ka onya ka kire ne pe board na aka ni nyina bet first na minim say Dr. Koboy we nya ahye na adwuma se a say afi no all go through betting and
use okay say no say parliament na be share time no my own process I go through ni say they would advertise so be a memorandum be submitted on the candidate forward the time frame and that time frame nipa ho then almost ashe time omo be veto nti
we na Easter ko na bozo expedite. So for now Dr. Koboy still remains the CEO and
he's in transition.
Okay. All right. I mean, in some board, some names have been mentioned, but you can put it across for now. Yes. Enti ashefo say o assembi bisa ubetimi ebisa doc wahana ubi bua wano papa. So now let's come to the problem of and why some facilities are being forced. Oh no, I wouldn't say they have been forced. They themselves are forcing to take extra money apart from their car. From where you sit, what is causing that?
Okay. Time be a saying kono. Name say your reimbursement say wako hospital, my hospital no wa share ne ayare for no ordinary bill. Abre NHI say yintua. For a long time the name say yam and yes I am yam peso intina bia yentua but in fact for society to be no mba no che bibi into those years back, those months back no now that was the situation. The inflow number sikana mba wa into sebi even though by law no any sense they took it upon themselves. Yanka say yen yama obi permission so nkwaje absolutely and there yanka be say obi ba akojiniska dey but they took it upon themselves however illegal it was. No mo yes omo jijiska the sense of say wa 5 months 6 months nisika mba obey then sebi what I hear for until that was the pain. Now for the past 6, 7 months or 8 months, consistently, busumi nunya sonya na etua busumi nunya sonya nti so bi ka se ne nsanka ne sika nti okoji sika na ento aso.
Okay.
Na mame nsan ka se ye nka se tariffs no a nhihye no ayaye me nka se bi a esombo de bi nya no na America. It's one thing performing your legal duty. We hear the amrat say yeah. Amrat say se mi tua oka busumi bia uni to me so abaka ko jiske if you be her so that you pay out of pocket payment and then the catastrophe.
Okay.
And then financial risks now with the money pack because all one card no onim say the trimu pefe me card there yare bom ya po free mu a me kwa e behwe me nti wenye du ho na afi be ka se kofa we bra do na ya na the risk
nti a offense a criminal
it's an offense.
Hospital we be charge wa bra where you card nti to me report to sa hospital.
Yes, we be report now beautifully say an bebre report nti am say last month was the last 2 months last month and they started say you notify hospitals any clinics you get whole report.
Into mo caution.
Yes.
And straight away
no,
issue.
the first time
okay.
We are cautioning all of them. We are cautioning omu nyina. Ye mpese beba dwem say.
Okay.
Now the next one letter no mu no ye kire bibia wo.
Okay.
And na ye mama fan say hospital no and our facility no is under Ghana Health Service. Ye ma Dr. Kum-Agbaje ya omu penny. Ye man copies. Into onim say Akosia Hospital say this is into ono so be frɛ omo no omo edi nkomo edi nkita ho say udin aba ukona wan kobo obre ya next time say whatever private sector womo so ye twro omo quasi governmental womo so ye twro omo tertiary ya twro omo into obi a ye fi say wa committed that offense no ye the letter quietly diligently but ni na no minister services ya onu wenya ne baby ko no onu na ye twro dikosi no so na dia eyen kran hyema ye nyina ne se sabe board no hihye no ye ne oku so no kan ye ho ene sesi onu so na ye twro so ye command minister copies
nti okwa
ba ko na hwe we so on so kwa akoto ene ebia be san so aba be ye hope say visited that area.
Interesting. Nti se me kra me card na me ko na yesi o card ne de ya age na emum eduro bi wo ho a ye mfa ma eno de obeto eno so
okay first thing the American say drug list no it contains over 500 medications.
Okay.
Yes. Quite a sizable
local and exotic
problem yewo or my say look at the British system NHS omundo ni generic there's nothing wrong with it boni bi eni ho but hano as soon as you talk generic omufi say inferior it is not and yet that is not the issue. But obi wo ho no ma sebe
doc me the generic metiase na ahwefu ntimi chirechire mu kaka dey na ye generic drug e dey na original drug
ye fan say your drug companies me pese mebo obi din but omo dey si omo enim say omo be ye nduro no omo ye nduro no wi a the first product eba no omo the din specific eto no na omu rekupu omu investment ni bibia no a eya omu wi a omu tumi ka se o ya ni company bi wo e bia oman we so ya ni company bi wo oman we so ya ma omu tumi so omu produce drone bi man na omu make sure say specification bibia processes ni nyina e totin te say dia omu ye no a ye fan say car industry who produce car e wa America e bia sebe na the board say see China here the same thing most of them are relocated to omu ye omu de ba
That's right.
But okay, say if you are no design come America for this is the process.
Okay. And dog me say over for draw back na dey example because obi timi but so where na me pe where na doctor back no where na de ma me the odi ama me we dey na say fake enti for a draw back na e ma yehu ni original no ni enhwe ni generic no so ni enhwe adwuma etimi
okay we dey say I'll veer into
pharmacology
promoting somebody but
we the example yeah
when find so obi about say 𝗦𝗢𝗥𝗃𝗃
okay
𝗦𝗢𝗥𝗃𝗃 a drop a friend proton pump say
𝗦𝗢𝗥𝗃𝗃 esa ya de ben sa
say our friend say ulcer into a tied man no boy
ulcer okay
ulcer for na your 𝗦𝗲𝗍𝗏𝗔𝗃 and no ye generic the original product na san your friend the company na produce first
na 𝗦𝗲𝗏𝗃𝗃 so
into obi ba na man 𝗦𝗲𝗏𝗏 man ni age woman 𝗦𝗲𝗏𝗏𝗏𝗏 no also ampe okay inferior so that is the kind of example I
okay all right so after be me say mati ase eye wo ya wo ye na duro no odin o de toso ana ye wo the medical name so aye de toso enti wo kohwe na din ni sesa doctor ne de onimudie ana pharmacist no so ade konzo onimudie obo so we eye say ma me ni we wo ho na eye the same ade krona eye amuma yenti doctor patches eye the same eye din keke na emum eye ne content no edro na egum na kwa na egum na ema yare ni ntimi sade eye pepepepepe dog afimba cho betima toa
yes nti no any the problem yeah na amount for account nti edro ni de bibi say e wa yan list no kwan so a you must not pay any kwan bi any wa say aju sika paracetamol any say aju sika there be malaria medicine e bi any wa say aju sika hypertension e bi any wa say aju sika because you a number of them e wa yan drug list so
okay first no you said na there were some few psychotic drugs meaning the more increasing it there and also so can be my kakra na me microphobia ni
that's right meaning pa the thing is say budget eba ye ho no eba NHI there's a portion ya demand ministry for the purchase of psychotic drugs it is taken care of
okay
allocation formula no every year there's an allocation we make for psychotic drugs
okay
yeah the ministry no so
okay
into sebi it's been taken care from day one
okay
we take care of that
okay
and a basic one or two be to say be a phenobarb those kind of very mild ones but the most important ones na mu here no and no na yema husika
okay
so it will go or say call your friend saying you're paying for more that department that faculty that's
your question be any maybe self actually because they be a tata shede no tata shede no no shede but the dog here twice we are opening back we friend no also for James Kofi Van Dyke method is so for penny pa we be no say all right into Obisa say is dog saying that if I live in Kintampo which is very close to 𝗏𝗏𝗏𝗏 hospital and I fall sick I have to travel to 𝗏𝗏𝗏𝗏𝗏 Polyclinic which is about 4 miles away to seek medical attention
okay the issue we raise two issues
yeah
access now access no your geographical access your financial access sabe o se Kintampo ni ska na me hu because Kintampo
geographical area mamensan emosu bi mu na enti no say if I live close to 𝗏𝗏𝗏𝗏𝗏 hospital and I fall sick do I have to travel to 𝗏𝗏𝗏𝗏𝗏 Polyclinic 𝗏𝗏𝗏𝗏𝗏𝗏 𝗏𝗏𝗏𝗏𝗏
okay so point in say 𝗏𝗏𝗏𝗏𝗏𝗏 a referral hospital referral center yes into ideally polyclinics are one in chain woman also
yeah but Polyclinic ni be main ho
okay
so 𝗏𝗏𝗏𝗏𝗏𝗏 ton I be 4 miles away
yes but there may be other
ebem say me na mambo see in Kontompo in contompo na mekobo na mama makwa akokase kentampo. Okay. Was in contompo you are correct. Was so in contompo which is very closer to Efiankwanta. And it's what in contompo eben eye Efiankwanta.
So what the ABC say if it is an emergency situation.
Okay. Okay.
Yes. And yeah, emergency, the polite thing they would do say, they may give first aid and ask, say, on
4 miles away. No,
and no interest, say, you see, this around Efiankwanta private facilities.
Okay, so you can go to a private facility.
Because I think we have registered and licensed a number of private facilities, a number of quasi-governmental, a number of friends saying church, Christian Health Association of Ghana. All these are service providers. Okay. In fact, one area also we have a whole array of service providers. Okay. The largest being public. The next is the private sector. Okay. The third is the Christian Health Association of Ghana. Methodist for hospital, Presby for hospital, Catholic for all those ones. And quasi-governmental, say Cocoa Hospital, Police Hospital, SNIT, military. All these are part of the Ahmadiyya. Okay. So there are quite a number of all these. Once you're a card bearer, you're making sure, say, at least across board, you register your licenses, almost all these ones. Will be to me.
That is also good enough. And it means this will be a national health insurance card. So Ukraine are buying hospitals on Kriana, buying polyclinics in Kriana. They go name private for a year. They sorry, Muslim for you now down. So obey media call. Usually in the year na omo de a year logo bi boho to unyehu health insurance logo no say boho pe utumi e the ballroom na year to aso na sana maybe a telephone line na make say national health insurance card ni biana so wo bia we experience it saying o de call ye je o de ewu ye uko renew ye saying na tie edura na doctor Chiroma wo di ko do pharmacist ho no o de ma o pepepa na o fra. Apart from so we beside Dr. Morrison, question be a dawakuma sono. We want to know what your experiences in using the National Health Insurance card. Meanwhile, our phones are open now 025-625-3461. 025-625-3461. Call in and ask your questions. To dog na ye ka se obi ebeko no so we dey yenye wa ha. Sometimes na on the part of a year one more hospital now worship because him say health insurance can use name do see kaba obenya bebre and this ye diga tie no menya den.
Yes, and no yeah one big problem ye face and ye how best we can solve. You be to me
doc menya Kobe who frefi tadi
we bacho
okay. Okay.
Can I go on?
Oh, please go ahead.
Okay. You papa Dr. C. Okay. Now, she said your kind of 95% coverage in health insurance cover, and they cover. Name going forward, if we don't take care, that 95% now may crumble the health insurance. The reason why I make a sign say. Uko hospital as we speak now, we build I also say the hospital. About 95% of them you pay out of pocket, and it is cutting across everywhere in the country. Recently, in the health insurance for established BBM co-payment committee in every district. They go there and they bring report to the national. Now the problem now is facilities. They use the health insurance. Reimbursement as a backup for them. And it's a Uko hospital. They will try every means to take the money from you as the patient. Then, when the health insurance money comes up, whenever it will come as more or less like a bonus for them. Because already found a way of taking the money from the clients. So until Health Insurance Authority, what do money be cost co-payment and cost of facilities so because you share amount of money on the core publicity more. So much to me year co-payment asking for focus with and even the clients will advertise for them, and there will be no need for much investment in publicity from Health Insurance.
Thank you. Point okay. Well made. Doc, you want to react to that?
Okay. Friend John, okay.
Yes.
Opening me that for question as in Bisano. The thing is, I'm saying somewhere along the line, we can say from last month, you started a letters call round. You notify facilities are almost this _illegal co-payment now. What can one say? Me pouch. If our clients would always be bold enough, normal say me call this or sometimes almost yeah and almost fret so me call higher just so so everybody's supposed to wear a name tag. Who to me fear anything, who to me fear facility no. To me
justice, justice, dear so that yeah, justice.
Hello, Reverend. Good morning.
It is saying so Gakope for who ye?
I'm here to move here.
Obe so Gakope hospital ana.
Me pachuan bo mo posit pepe.
Okay, sure. Kasa yetio.
Me pachu yo. There were two quick questions. Me braba kunya accident, I think a year or two ago now. We started the treatment from a district hospital. Now, a referral call one big hospital in Accra. Now, you drew on immediately. No more and say, "I'm on health insurance."
Wow.
So I asked questions. Say,
was it a government hospital or a private one?
Almost a quasi governmental.
Okay. All right. Sure.
And I was like, then we need more education because. If you district hospital Nayaba, so we think that it will continue like that. So instantly we had to pay a deposit of about 2,000 cedis.
Wow.
And I was a bit, in a dilemma. If much education will be given on that area, it's a very big hospital in Accra, and I was a bit surprised. And my second question is to say, when it comes to the points where health personnel, secretary will say, a drawway, you need a facility in a trauma, like sometimes I think about it, I'm like, could it be a way some of our health personnel could do anything untoward? Because maybe I'm about hospital, drip bear 5, Namakoto mu 3 aba. And I'm like, some of these things in treatment of general conditions are doc body. I feel say their health insurance should cover it, but at the end of the day, no need draw bear 6, no. You are draw bear 7, 3. Mama say, oh, you need be in stock, so Konakotobra. In the really, it's a semi cash and carry now.
Okay.
Sometimes
very much what Doc could be come first one. No, it's the first one. Yeah.
Inti Wukoya almost say uncover no. Ube bold now to me I catch and said this name the people name my Dina we will follow up. Okay, your friend saying co-payment committee. Yes, yeah, Titi co-payment committee, and I'm sure the way he's talking, he knows from inside. Yes. Into these co-payment people, one of them report in by. It is from this report, and I had decided said the first time we'll write directly to them, give the ministry copies so that the ministry is aware. Their own organizations, like if it's a public, the Ghana Health Service, if it's a private, the private.
James, who can say fit Tema, dear Dr. Morrison, Honote. James.
Papa.
Yeti.
I was a 𝗏𝗏𝗏𝗏 hospital, not Asna one, so. When that Thursday, 1 week, and I'm a home so, 𝗏𝗏𝗏𝗏 hospital. Into Mokra, a ward, a woman. What was the Moko emergency? I am a check and was Moko emergency. Never emergency. Into Moko emergency, I'm a check and I had a pressure. And now, mammy was the first age. The Druna nurse, not the mamma. That, and I say 1.5. Drew asthma or what trunk getting no mammy first and second.
150 asem na okay.
And that what's it?
150 Ghana cedi.
150 Ghana cedi. Nti akansa na me say oh sika mi kita no 1.2 nti no 1 million na 20 Ghana na shamo no mu yi me. Nti so mu yi me a na ma fe we financhi. Na sense debi on tiase ade no wapon okọ. Nti ade nti na no so madam mu yi me. Na de so emergency na mo de aba na emergency na tresan. Emergency ba tresan ni pa no ho mfa no nti mo hwe no na bia me kwa na me bae. Nti no mo de mo nje 1 million na nka 50 Ghana na mo tro nhye me bill na ase. Se mo me bill a me tua. If nurse ya baba kwa na no mo ni skara mo so am ba hospital. Na me say the nurse health insurance e kire dan. Health no ma ba hospital me won fa me. Na ma ba nya discuss miss me tua. Mo nje 1 million. Na ka balance of 50 Ghana na da. Na won se me no kwa da. Me ka na okay mo de chino twa no. Na me fo fe na mo sa na me skada bi dan. Me say wo da mama mo nhwe me bi. Na me omo tro bill me ko tua e. Nti mande na mo kwa polyclinic. Ema mo hwe me da me gi me ka say yo.
Okay.
Again.
All right, Doc. So these are some of the things we are looking at. So this is an asthmatic condition, and it is it is right among the conditions you are speaking about.
Absolutely.
But 150, and I'm beginning to imagine what asthmatic drug is 150. It not just say buapayo, and as nipa no person ya na and your nurse so na charge. Private hospital there you say and your nurses not to be double up. But in a government hospital like you have mentioned, and your nurse na charge sika. Nurse in sika. Doc.
Yeah. Say after this program, if you can get in touch.
All right. All right. Auntie James, producer, yes. Doc say James and get in touch.
Now make sure say receipts na there now the amount now. So my amount receipts that is fine. We'll take this thing up.
All right.
Because it is completely out of order.
It's not a good one. We also the auto tema ain't no. But me no be so a feature for praso. James.
Yeah, my name is Ben. I'm calling from Kivu.
Oh, this is Ben. Sorry, Ben.
Yes, please.
Go ahead, please.
Okay, thank you very much. I want to thank Doctor so much for the much insight that he has given us into this insurance issue. Yes, and I CP now them work on the co-payment, you know. And if the board can give us a link, because wherever you go, and your secretary, you will pay and they will issue government of Ghana receipt for you, which means it's legal, that has been established. Because if I illegal, they wouldn't have given you official receipt.
Okay.
So you pay and the hospital will issue official receipt, which shows that the services that you are paying, even though you are holding health insurance, you are paying alongside. If the board can give us a link so that people who have paid for while they are having health insurance can send those receipts for them. They will have the name of the facility there so that they can even move in and question the hospital why they are doing some of these things. Because I think they are making health insurance unpopular.
All
now,
right.
when your
Thank you.
Okay.
Thank you so much. Doc, in any whistleblower number.
Yes, first of all, no, young call centers now you once you call and say why I co-payment, they will take your particulars and ask that you talk to a special line. Then maybe our fraud. The important thing is receipt. Everybody should ask. If you say it's a co-payment, indicate exactly what I'm paying for. Don't just let them give you a receipt, say cost for whatever
medical services.
Medical service. Say Druby award you be make sure that one shot because when the time comes they will deny.
Nah, okay. Do almost share that the fra. But yam fa mami esi.
Papa.
Ogwa kotokraba na okasa fi.
Hey, mukro.
And what person?
O kasa fi ogwa.
Gwa papa na mkosi
kekko.
Yo, ye too.
Me post no. has na one can Annie. Motomabo hospital, Muko easily played with that one. She didn't mean that for sure. The market is also the means that for sure with tack. Echo, a doing what your arm. What will back to the coach yet them negligently feet. You know what so? Mukoya, my woman may do more days they have to cover me lager. Damn, could discuss and sign with the dynamo. Every day, Muko discuss and sign with the dynamo. It is in you are in a watch your arm, cocoto. Into Mr. Bafano one in day. Them in water.
You
Mammy, on to them.
If you there, a help into if you make a company that is the Navy. You know, Banazamo. If we were back to me now, Mr. Duck would be. Please, I'm for them to the Penelica. Or come with 10 pesos, what's what's the wall? I want to tell them about it. What's the wall, Miss no, I just couldn't have water. Why the more oil? I'm not at the hospital, the Mutumabo hospital, you know, I'm so putting.
I will bet to my bodino.
Mr. Stephanie, quiet. You may plan and look at Mesrica.
You yate, that's it. Let me say, any brother. And you know, they are legitimate. Behind the scene, you and I know that they are very legitimate consents from. Enti sa achura for ya omo ye an in-depth investigation into this omo homene so. Now whistleblower lines and so making available. We might have to do a part 2 of this. Yeah, better cases no mako because means I've read for efresa. Enti producer no be kasa we chire na ya. Enti we dey bonetofa running up under 1 minute my na. Yo.
The thing is I power na I apologize on behalf of NHI. I don't see why somebody should be paying out of pocket and a co-payment because the Brenara one cow reimbursed one almost to date. I want that still wired, but that is the beauty. They are set up them committees and they are one report I was the man on the age now to say you take action but Miss Pahumicho I homework. What reporter one for hospitals needing don't shelve them. On no mama yejuman or ya kakra because we should be an akaka. Was so anti-Araban or Bekanzi, anti-Araba Baha, Yan Bio. Obi and YouTube do bear them. Obi and YouTube do bear. Intimacy. Give us the facts. Okay. You be pursue. You be do.
Look, you be that. I said yeah. Can we be having a part 2 of this? Naya Samba. Same way we hear your part. But then we have been looking at access to health services in Ghana with the NHIS in perspective. Na yeah papa, yeah bra, yeah Dr. Isaac Charles Noble Morrison or yeah private legal practitioner. I feel so a member of the NHIA board Ghana ha. Papa you better was say ne oni ababe di sankomwe. We have some visitors with us and we are going to briefly ask them why they have visited us this morning. Please take and stay.